So this video is created to give some guidance, particularly to my team, but to anybody who's doing telehealth with couples. This is specific to telehealth with couples. Now there's a lot of other telehealth things that teach you general tips for having a good telehealth environment, but this one's specifically for working with couples. So one is to start out just to recognize that we are all in this together. The stress of being forced to do telehealth, maybe when you wouldn't prefer to do it, or even couples wouldn't prefer to do it, that is a real thing. And at any time that we are still social isolating, that the risks for depressions are real for both us and for them. It's really important for us as clinicians to practice what we preach in terms of self-care and watching out for ourselves, to not set up unrealistic pressures. This isn't the time to write the great American novel or to try to become the best therapist that ever walked the planet, right? This is the time to do a good job and do the best we can with the environment we're in. Remember that we join them in their struggles, right? Whatever it is that they're facing, whatever struggle or difficulty that they are facing in their lives, we are here to join with them in that. Our job is not to fix it for them, and so we want to make sure that we have that attitude, and that includes, technology issues. And of course, always remember, whatever you're facing, you may face some things in a telehealth environment that you weren't trained for and you're not quite sure what to do about. To take a deep breath, ask God for guidance, and then move forward. Okay, so before you have your first session with a couple, make sure you're getting the intake paperwork and that you've looked it over. From there, take some notes. For the people on my team, we actually have kind of a table of data to fill out, and you might want to go ahead and fill that out before you meet with them the first time and get all the information. But at least you want to be writing down red flags and things you want to follow up on. There is a telehealth consent, and before you go past the first few minutes of the first meeting and actually engage in anything other than hello, you should make sure that the telehealth consent has been completed according to the instructions you've been given. You want to have a plan for the meeting and the ability for yourself to take some notes. So you may kind of have like a little thing here sitting on the side for you to take some notes. Make sure your room is set up well, that you've got good lighting, your face is on the screen, you have a decent background, all those good things are set up before the session. And you always want to have their phone number handy in case of audio problems that might pop up. When you're setting things up, you want to make sure you do not look like this, right? This is not what we want to look like. So you want to make sure that your camera is kind of up close to the height of you. As you can see, if I do this, it's actually even a little bit nicer, but I didn't have an option easily to do that right here. So, so make sure that you kind of get that set up from the beginning. This may be a pretty background, but no, you shouldn't have anything too personal. And of course, especially when you're doing couples therapy, but any kind of therapy, you shouldn't have a bedroom in the background. This is a nice one. You'll notice it's the same one as mine, but there are others like it, but a bookshelf or some similar kind of professional looking background that doesn't distract is good if you're using a green screen or if you have something that beautiful in the office or room that you're meeting in. I just kind of want you to look through all of these and kind of get a sense of like, okay, who seems to be doing this well and who seems to not be doing this very well. I want you to look at, Rob Rinsky there with the baby picture. Yeah, not for professional, right? Okay, so don't be sharing baby pictures with your patients, right? And Mitchell Mays right next to him is like this little tiny person in a screen. So that's not so hot. I think Farah Class down at the bottom right-hand corner, she looks pretty nice. Wearing headphones is fine if you like to do that. George Basil on the bottom left-hand corner there, he's all washed out. You can hardly see his face. So you want to make sure that, your face can be seen. James Desmond right there in the middle is also this like tiny little head in the middle of a screen. John Mensick has a problem that a lot of us have, and that he's kind of a big guy. And so he's does pretty well there with, making sure it's just kind of up from the upper chest up. And it's just kind of focused in on his face, and they can see his face really well. He's a little bit shiny. And I even recommend to guys that you consider getting some baby powder or something, because shine is something that really does pop on a screen, and it will make you look not quite as professional. But Zheng Tang Gu there on the second row all the way to the right is a little too close, right? If I'm up this close, it's just too close. So you want to be able to be seen and not too far. Right now, for instance, I'm about 18 inches maybe from my camera, but you'll have to test it with your camera. So make sure you spend some time on that. Distance from the camera is important here. Both of these look good, but I think Trevor Noah looks particularly good. Notice how his head is at the top of the screen, so you can see him and see his movement and that sort of thing. I actually put mine up a little higher because I'm larger in the middle, and so I want to not distract from that. So you want to be adjusting to who you are and what you look like on screen, but make sure especially they can see your face really well. All right. The very first session is generally a screening type of session in our clinic where there's just some basic information and appropriateness for couple therapy that's happening. If you're in our clinic, the screening note will walk you through what the objectives are for this session. One of the things before even the screening session happens, if you don't have both of their online assessments, right, their initial assessments completed, you'll need to call them and reschedule. So you want to watch that, and maybe at the 48-hour mark, give them a call and say, hey, I don't have it yet. And then if you still don't have it right before the session, either call them, or if they come online and say, hey, we can't do this meeting because I don't have both assessments, you're going to need to reschedule, and they can just reschedule in our system with our 10 to 8 scheduler that we do. Part of the screening is setting up technology issues. So remember that as you're going forward, that's kind of a new thing in online care, is problem solving with them to make sure they're going to be able to get the most out of their intake session. So do they need to go purchase a camera because they don't really have one, or a working one? Do they need to get a lamp and put it on the other side of their camera or their computer so that you can see their face? Do they need to get a TV tray or move it to sit at a desk or something where they can get their TV up higher? Because you don't want them to be, like this, and you can't really see them because they're way, way up here like this. I can see the edge of my green screen there. All right. When you're doing the screening session, you want to introduce yourself and start with some small talk, just like we would in the office. This helps people to relax and create a little bit of rapport. And so sometimes it can be kind of jarring because we usually have that walk, right, from the lobby back to the office. How's parking? What about the weather? That sort of thing. So feel free to bring that up. You can talk about anything that's happening, lately in the news that's not going to need to be processed, right? You might not want to talk about Black Lives Matter because that might need processing, but something more like, hey, did you hear about the panda that had a baby in the news, or something that would be not emotionally meaningful for them. Hopefully, what would be emotionally meaningful for most people anyway. Make sure before you even get started that you can see and hear both partners, and do not hesitate to ask them to move their seating, move the camera, relocate, all that sort of thing. In the screening session, you're also going to need to ask, like, are you in a room where you're able to close the door and have privacy? What is the situation with that? Because you may not be able to see all of that. Are you guys alone, just the two of you? Do they have pets? Do they have children? What are the needs in the household at the moment? For the screening session, you can probably be a little more flexible and then maybe problem solve with them about the future. And we'll talk about kids later. But make sure you can see and hear them both. And, your general response to all these kinds of things is, I want to do my best work with you, right? We want to do our best work with you. And so you want to make sure that you are able to communicate that to them in the way you set up the session. If you have a high-risk screening or some kind of topic of discussion, for this I'm thinking things like domestic violence, someone's thinking about separation or intent to separate, and then infidelity. You're generally going to be spending time on individual meetings if this is coming up, right? This is going to happen almost all the time. If those individual times won't fit in the hour screening time, particularly if you had to spend a lot of time getting technology to operate for you and you missed 20 minutes maybe of time or something like that, then you may need to reschedule. And I would ask if you're doing the screening meeting that not reschedule, sorry, that you would schedule another meeting, right? Maybe individual meeting times, that you do that in a way that will fit your schedule and their schedule and keep with the same person. It would be okay to do those individual meetings by phone if need be, as a kind of a backup plan if telehealth options and the ability to come in and do the telehealth video thing is limited. You want to ask in these situations if they think they could be heard by other people in their home at the time. So their spouse, particularly domestic violence, but also intent to separate or infidelity, if their spouse is not aware of these things, it would be really important. Or if they have children that are old enough, to understand words, that, should know about these things, perhaps. So there's a few things you can do if they seem unsure how to handle that. You can suggest that they consider headphones so that your words cannot be heard. And that is a really good solution. Suggest that they move rooms perhaps, and kind of call you back or carry their computer or their phone another room if they can. Or even that they meet by phone. If it's an individual meeting again, there's less concern. And they could even get in their car and meet by phone in 5 minutes, right? Like, hey, I'm going to call you back in 5 minutes. And by then I'm hoping you'll be in your car and you can either, drive down the road and talk to me while you're sitting in your car or in the driveway or whatever. Another one, if you cannot do some of these things that will increase the chances of confidentiality and decrease the chances that someone will overhear, then consider using code words. So you might say something instead of domestic violence, you might say something, that issue that you indicated in your paperwork about conflicts, right? Or if it's something about intent to separate, like your future plans for the relationship, that you talk, you put that information in your intake paperwork, or maybe relationships with other people in your life, right? So it's unclear, maybe that's friends, maybe that's not, but you hope that they are kind of catching on. These are more difficult issues, so take a deep breath, ask God for guidance. When you are setting up a room for 2 people, make sure, again, you can hear and see both people. Typically, a computer does a better job with this than a phone does. It's difficult to get a phone to pick up on the audio well and to be able to get 2 people in the picture. If they must do phone cameras and you can't see and hear with the phone cameras, suggest perhaps that they log on to 2 of them. And so maybe they're both on their phones in the room with you, each of them, and they may need headphones so that it doesn't reverberate in the room. Do be firm about your needs. Like, you have to be able to set up a scenario that works. So if need be, ask to move the computer, put it up on books, make sure get what you need. And you may get it correct one week and then they are not getting it correct the next week, and just be firm about it. Your attitude should be, I need to do good work for you so that I need to be able to see you. And you might even be able to explain. In couple therapy, there's a lot of in the moment, noticing reactions and processing them. And if I can't see your reactions to each other, then I am really hampered in my ability to help you out. Remember, this is what it is. Let's not bemoan, let's not complain. We're not going to apologize and say, I'm so sorry that I have to ask you to move your phone, to meet this different way or to get this resource. This is what it is, and we're all doing the best we can in an online environment. Whenever you're setting up sessions, for regular sessions too, do start with some small talk. Make sure that the process of what's happening in therapy in general, if it's an intake or early session, or the process of that session and what you're planning to do, online may require a little more clear instructions than in-person will do. For what's going to happen, and especially you've got 2 people who you want both of them to understand it. So frequently ask if they understand. Do they have any questions? Maybe more frequently than you would in an in-person session. Ask them to summarize what they plan to do in response to what you've been discussing. And that will be another way of checking to make sure that they're understanding what's happening. It's really helpful for online work to set a clear agenda. What do they want to get out of the session? And you might even take a note really quick, maybe a few words on the side for yourself of what they said they wanted to get out of this session. At the end, what are they going to take away from it? And you might ask them to take the note then, right? Both of them ideally to take a note. And so that would be like a regular part of online therapy, is that they would bring a pad and paper to write things down. Again, because communication can be more easily misunderstood. And what are they going to apply at home this week, or what is their homework going to be? And again, you might ask them to take a note on that too. In person, you might, give them a handout or write a note for them on what they could do on the back of the appointment card or something. You can't do that. So you want to make sure that they can write the note. We do feedback sessions, and a lot of couples therapy does feedback sessions, not just the Hope approach here at our Hope Lab at Regent, but you're going to have some unique things with the feedback session. One is that you're going to want to use the screen share to highlight things in the report. So you're going to pull up the report in the screen share and go over it with them, highlighting things. Ideally, the report has been emailed to them prior to the feedback session, and within the email, you ask them to read it prior to the meeting. That's probably the best way we can handle that. You want to check in often when you're reviewing the feedback report, because you might not be able to pick up on subtle cues as easily as in person. So a little more frequently saying, do you see things differently? Do you have any questions about that? Does this seem to line up with your experience? Kind of maybe at each section that you go through, make sure that there's a conversation. Feedback sessions tend to have us talking a good bit more than the clients do. So you want to make sure you're engaging with them in that session, and that you've got really good microphone in that session too. There may be some adjustments. I'm just picking a few things here when doing interventions with couples that you might want to consider adjusting to. One is if they are in quarantine, or whatever level of quarantine that they're in right now, to talk about what rituals or liturgy or habits they have as a family. Are they doing weekly couple and family meetings to talk about the logistics of running the household? They're spending a lot of time together, but it may not always be productive time. So for instance, if they have reduced income and there's going to be more decisions that need to be made about money, they may need to plan for some more frequent meetings to talk about their finances. And there may need to be discussion about how to give more grace to each other, more a sense of like, you're stressed out, I get it, I'm not going to put too much on you right now. You might consider, when doing online work, to use books, workbooks, or a website like our website at hopecouples.com, which has a lot of worksheets on it and things. You can't hand them worksheets very easily, right? But you can send them to the website and get that. We do have a confidential email message system, and we'll be talking about our procedures for that in our own clinic. But if you have that available to you, you can use that, of course. There is a standard, like I call it the vanilla approach, right? Like the nothing special approach to Hope, that uses the most common interventions, and it's a workbook, and it's not really beautiful, but it has good content on our website. So if you have a couple that seems to be kind of middle of the road without special needs, you might consider using that, or using parts of it if you have a couple with more special needs, and you don't want to use all of it maybe. If you want to do the intervention where they record themselves and then watch themselves communicating with you, and kind of try to have some insight into the ways in which they communicate or put down or condemn or have contempt for each other, those sorts of things. We are not going to be able to do that really. Like Zoom doesn't record for telehealth, and there's all kinds of HIPAA concerns about that. But you can ask them to record themselves. They can record themselves in their own home. So you might ask them to take their phone and record themselves and then watch it, and you can listen in maybe to it. Of course, you just watch them communicating. Hopefully they stayed on the screen, and you have a chance to kind of help them process what they're seeing when they watch themselves. That this is better than us trying to find some kind of secure recording option for playback. Okay, so there's all kinds of problems that people have brought up, and I want to try to give my best answers that I can for how to handle these problems. So what if a couple floods out with negative emotion during a telehealth session? So this is not that different than an in-person session. You can stop the action with your voice. Go ahead and use your voice. You might even need to get in a little closely and say, all right, let's take a second here and let's all take a breath, right? You can use their names if you need to get their attention. That'll help to slow it down. You can ask them to take some deep breaths, or you might even ask, since they're in their own home, would you like to take 1 or 2 minutes, go get a glass of water and come right back, right? Will you be able to come right back, right? Just take a 1-minute break, right? And just take a breather. Would a relaxation exercise help? Even the 6-second breathing exercise, right? And just do that for 1 minute, where they breathe in for 6 seconds, breathe out for 6 seconds, breathe in for 6 seconds, and you'll keep track of the 6 seconds for them. And you can just count even, you don't have to have a stopwatch. And then when they seem to have kind of like caught their breath and the floodwaters have come down, then return to talking about what just happened. And of course, anytime they're flooding out, you might be feeling a little bit of flooding. So you might need your own deep breathing, right? Some kind of relaxation, and asking God for guidance. What if somebody walks out? It's a little easier in their own home for somebody to get up and walk out because they got very upset. So you might consider if they need a little individual time with you, and to talk about practicing what to do in moments when they flat out. Do they need relaxation exercises? Talking about how walking away doesn't move everybody forward. Can they at least stay grounded in the moment? You might be able to do individual time with that person while the other person's in the room, but you might need to just do individual time with them in general. So you may have to communicate by phone with them about that and to find out what's going on. But in general, you don't just kind of keep going with the person who's sitting there. You might check in on how they're feeling right now and how they're doing, but you don't just kind of ignore what just happened, of course. Clients getting on their phones or devices. This is a problem, of course, no matter where you meet with clients, but maybe there's a little bit more. So you might check on, what's going on. It looks like you're checking your device. Is there a problem? And it maybe, their babysitter's trying to get a hold of them, or they have a family member that's in the hospital, who knows? So, you want to kind of realistically problem solve with them. If they're distracted, it may be hard to get the most out of that hour time together. Can they put the device away during the session so you can move forward and do your best work? Or is it reasonable that, they're going to have to watch for the babysitter because if there's an emergency, they have other things they have to respond to. And you can be understanding about that. So another thing people are worried about maybe is getting people to open up and be more natural on the computer, right? And that they're not maybe stiff. I think this is what we have, first of all. Like if telehealth is what we have and in-person's not an option, then we have to set the standard and be role models on this, to be natural about it. And I think you'll also find after a few sessions, people tend to just kind of settle in, and it's not too difficult. They get used to it along the way. You might find you get distracted, right? Like a problem that you might face. That happens. If you have anything you can remove from your environment, maybe your phone or anything that can bing on your computer, or those sorts of things that would distract you, remove what you can, then acknowledge the distraction and get back to work, right? And move on. If the video freezes, same thing, acknowledge it and move on. Oh, the video froze. What I was saying was, right, if you repeatedly are finding the video freezing and you're having a difficult time with connection, you might consider getting on the phone together so that you are on the phone talking to them, right? Either speakerphone or on the phone, and you've muted your computer, and you ask them to do the same thing so that your phone will continue the audio more reliably and the video may come and go. So you still get some video, maybe if the video is freezing, but at least the audio will continue, and that will be less disruptive to the session. If just the sound is cutting out, again, acknowledge it and move on. Repeat what you just said, or ask them to repeat what they just said. And then again, if this is happening repeatedly, use the phone solution. Another problem people ask about is they don't like how they look on camera. Well, that's not unusual. Don't forget, this is not about you, all right? This is really not the point. They're not gonna care about how you looking like a movie star. You can get a peer consult for your best self, making sure that you are doing the best you can with what you have. And even if you can't get a haircut like you would like from the people who do a good job with it, you're still doing the best you can with what you have. Another thing that's helpful is if you either minimize or turn off the little video of you on the screen, because that is actually distracting. And so I've seen some things that recommend turning your own video off, right? Basically not off to your client, but minimizing it so you're not looking at it once you can see that you are seeable and that your head's not like this or like this, you're in a good spot there to go ahead and turn it off and let it go. And then you don't get the stress of looking at yourself a lot. If you want them to talk to each other is a common thing. Maybe they're telling you something and you're like, you really need to tell your partner this, not me. So you can ask them and just say, hey, can you turn to each other? I know this may feel odd because you're sitting close on a couch together or at a table, but can you turn to each other and try to talk and try to keep up the volume a little bit so I can still hear you. And so give them the direction, just like you would in the office, to turn towards each other. And you might add the volume piece because we're online. Maybe you feel afraid of this process and what's going to happen, right? And feeling like I'm not ready for this. Part of our role is to find peace, right? In all kinds of anxious situations. That's what we're helping clients do too. And clients will pick up on our anxiety. So you want to process that and find ways to find peace, fake it till you make it if need be, and talk about it in supervision as needed if you're continuing to feel anxious about the process. Issues with the kids. You notice a lot of things on this page because there can be a lot of issues with kids. So in general, it is their problem to solve, not ours. Right? So remember that the principle's the same whether it's in person or online. But however, if we're in a situation where things are highly quarantined in their city or in their personal situation where they can't really get a babysitter or have people outside come in their home, we have to be realistic. If it's possible for their children to go to bed early or maybe take a nap at a reliable time, you might ask about that. You'll want to talk with them about setting up for success, like what kinds of things might they need to do in order to make sure their child's going to be fairly happy and not need them very much during that hour, even if they are awake. So things like making sure they're well fed, they're happy, they've gone to the bathroom, or they've had their diaper changed, and they have some kind of entertainment that maybe is an unusually good entertainment for them. If they have a child or children that are in arms, right? So they're too small to get around, you may just kind of have to deal with it a little bit. So talk about the need to keep things fairly calm for the sake of the baby's health, and that parents yelling in front of even an infant will actually affect their vagus nerve and may cause long-term problems with that, with their own anxiety. And so you can kind of educate them on that. And so, to say this may affect their work a little bit if they're trying to kind of keep calm in front of the baby, but they actually have a lot of feelings. However, we don't really like them yelling at each other in our office, even without a baby, right? So this could work out okay. If they have a toddler or preschooler who's kind of moving around all the time, this is probably the most difficult age group for doing telehealth. So talk about the use of a babysitter, or maybe swapping with a neighbor, the use of a family member. If need be, perhaps they can do a favorite movie time. Most of the time, toddlers and preschoolers have kind of a favorite movie that they could watch, and they could maybe keep it for that hour and make it a special time. And some kids in this age range can go to their room for kind of a quiet time, even if they're not asleep, but they're given, some books or some things to do during that time. With children in this younger age group, if they're interrupted, it's really helpful just to watch and see how they deal with it. This is information about them, like who responds to it? Do they respond angrily? Do they respond supportively? Like, what do they do when their child interrupts something that they're doing? And this may be something that you might address in therapy even, and that you might not have otherwise known about because you weren't around their children in their home in in-person meetings. And if you have ongoing issues, you probably want to bring those to supervision and get some extra help. Or if you're, not in supervision anymore in your life after this supervision time is over, to get some peer supervision. So after the session, I think that there's something really important, because online intervention requires more communication to kind of set up the rules, and because it's not something that's normative in our society, we have to do more communication. So your phone call or the voicemail that you leave for them with reminder phone calls, I think should have a few things in it every time. One is the thing you usually do. Hey, we're having a meeting Wednesday at 6 o'clock. I look forward to seeing you this Wednesday, and we're scheduled for the next several Wednesdays at 6. Right. So telling them every week we're scheduled for this time. Or if you know that there's a holiday coming, or you know that they're going to be gone on vacation, you say, well, we're meeting this Wednesday, and then I know you're gone on vacation next week, and then we'll pick up again the following Wednesday at 6. You want to go ahead and mention what you did last time, right? So our last session, we addressed communication with a tango exercise. And our plan for this next time is we're going to add to that to talk about underlying interests and common interests that you might have. So just the subject line, essentially. And you decided that the homework that you were going to do last time was that you were going to do some listen and repeat. So I'll be really interested to hear about that when we meet. Okay. Thanks. Right. So that can be left on a voicemail. You might have to talk quickly for some voicemails, but you could do that. Or if you get a hold of them, to be able to talk about those several things and then say, any questions? Okay. So it's kind of an opportunity to do, again, that extra communication, but it also reinforces all the things you're doing in a midweek intervention, which is great, actually, in some ways, right? It's a good process model. In our clinic, we do have a phone-only option. So we have people who are doing brief 20-minute phone calls for care. And so you want to kind of assess why phone only is happening. Is it possible that they don't have access to the technology? Is there anything we can do to help them with that? And do they have a friend or family member that they could borrow once a week their thing, their technology? Like, is there something that can be done so that they can get a higher level of care? And should they do individual care for the relationship, because a phone really does limit our ability to see reactions of a partner and that sort of thing and make it more difficult. We really shouldn't be doing red flag type couples. So couples who have infidelity, recent infidelity, or domestic violence, or, any of those kinds of things, issues of substance abuse, those ones that are kind of sitting on the line where like they qualify for couple therapy. We should be a little more conservative with phone only help. 20 minutes, of course. Couple therapy is not the same as a phone only. This is more like a coaching or an employee assistance program kind of model where you're kind of helping with an immediate need and helping them kind of return to regular life, right? So you're not really doing a transformative model here. Really with this kind of phone consultation, it's more of a meeting immediate needs, right? And problem solving, kind of solution focused approach. You might consider using a workbook, book, or online interventions really heavily. So they could do those things and then they check in with you on how it went and problem solve any issues and then kind of pick the next thing to do in the workbook or the online interventions. You want to focus on a specific problem and be really firm about it when you're doing phone only. So don't let them talk about the kitchen sink. They're not supposed to get off on tangents, and to be really firm and say, hey, our goal for this session was to talk about the difference of opinion you have about how to save for a rainy day. That's what we were working on. And now it seems like we're talking about parenting. So I don't think we can do both in our brief meeting here. Can we stay with the issue of, finances or whatever? So you may need to check on their partner reaction more frequently since you can't see it. So if you are doing phone consultation, you might more frequently need to say, so what do you think about that? Sally, what do you think about that, Jamal? Like, what do you think about that, Susan? So you kind of, the person who's not speaking, especially if they say something that's inflammatory, you might need to check on that a little more frequently. And finally, just to kind of remember, I don't know how long this is going to go with telehealth. I suspect we're going to have telehealth permanently now in some way or another, as people are going to get used to it and decide it's pretty great in many situations and scenarios. And so it's going to be part of things, but hopefully we don't have quarantine forever. But this may not be the only disaster in your lifetime. It probably won't be. I know I've had several world disasters in my 20 years since I graduated. And so being able to function during disasters is an important skill for a psychologist to develop. We are providing care, just like medical doctors and nurses and medical staff are. We are the mental health care for our country. And so we have a responsibility to figure out ways to take care of others in times of crisis. And that requires a particular set of skills, right? Being able to adjust to fit new situations is a really important thing for psychologists to do, and not to be stuck in your ways. Of course, you guys that I'm talking to are students, so hopefully you're not stuck in your ways yet. But you're not going to just follow the textbook, and you're not going to just follow like the 2 sessions that you've observed before. You're going to have to be able to adjust. You might need a CBT yourself, a grounding technique, looking around. Am I safe? Well, and do I have what I need right now? Okay. Right. So staying in the moment, can't borrow worry from tomorrow. Make sure you have quarantine buddies who help you monitor yourself. We're very hard to monitor ourselves. So if you live with people, giving them permission to say, hey, if you see me starting to lose it, can you talk to me about that kindly? Or if you are living alone, that make sure you have some people that you spend enough time with that they would know, and that you're honest and open enough with that they would know, which is also a really great life skill to have, is to have people in your life like that. Give yourself a lot of praise and encouragement. Like, I am doing this. We are in a major pandemic that people are going to be talking about like for 100 years, and I am making it, right? So it is really important to say those things to yourself. Dig deep into your spiritual resources. There are a lot of voices of wisdom out there. You can watch and listen to those voices of wisdom. You can read books. You can spend time in meditation and prayer. And those are really important things to do in this time. You will find a big difference when you do that. And if it's all too much, I know some people have additional things, or the quarantine affects them disproportionately because of personal factors. Consult with your supervisors and peers. Maybe find your own therapist. It's a time to get your needs met, talk about potentially cutting back, the things that we do as psychologists when it gets to all just be too much. So, all right, thanks for listening. I hope this was helpful. Really appreciate it.